Hello, everyone. This is Morgan Cook with Positively Osceola here for Positively Osceola's Daybreak Live. We are so excited to be coming to you this morning right here on Positively Osceola with Orlando Health Surgeons. We have two special guests with us. We have Dr. Elms and Dr. Gibbons with us. That's going to be giving us lots of useful information. We've been so thankful to partner with Orlando Health and have them continuously coming to us, giving us all the details when it comes to our health and what we can do to put our best foot forward to having a healthy lifestyle. So very excited to have our two special guests with us this afternoon. So be sure to say hello whenever you hop on. Hit the thumbs up button, hit the share button. Let me know in the comment section who we have with us. I'm going to come on here as well and hit the share button. So that way everyone gets all of the information that we're going to be sharing. It's going to be a great discussion, lots of questions and lots of details to share with you guys. So very excited to have our two special guests, like I mentioned. I hope you guys are having a wonderful day so far and having a great kickstart to your Friday. I know we got some fun weekend plans. So hopefully you do as well. So coming on here, I'm all shared, ready to go this morning, ready to get started with our Daybreak Live. Like I said, hit the thumbs up button, hit the share button. Let me know in the comment section who we have, and we will go ahead and get started with our Daybreak Live. So like I mentioned, we are very excited to have two surgeons join us from Orlando Health. More than 1 million hernia repairs are performed each year in the United States, and more people are living with hernias here in America. With this month being Hernia Awareness Month, physicians at Orlando Health, Dr. Phillips Hospital, want to help keep the public informed on the types of symptoms of hernias and exactly when they need to see a doctor. What's for sure is that a small annoyance can greatly affect your quality of life. Persons with a hernia can experience anything from a change in appearance of their abdomen or groin, chronic pain, or risk of opioid addiction or mood disorders, to life-threatening emergencies that require emergency surgery. The good news is there's less invasive options now available, which can provide a quicker turnaround to a normal life, as well as tips to help you identify a hernia so you can prevent complications of a hernia from happening to you. Orlando physicians Dr. Elms and Dr. Gibbons utilize minimally invasive and robotic surgeries when dealing with hernias. Additionally, they utilize a procedure that does not require patients to use level 2 drugs like oxycodone, and patients can resume life sometimes within 3 days of the procedure. So at this time, we're going to go ahead and welcome our special guests. We're very excited to welcome General Surgeons with Orlando Health, Dr. Luke Elms and Bobby Gibbons with us this morning. Good morning. How are you guys?
Good morning. How are you? Thanks for having us.
We're very excited to have you with us. Go ahead, Dr. Elms, and start us off by introducing yourselves and giving our audience a little bit about yourself, how you came to Orlando Health, and what you do there.
My name is Luke Elms. I'm a surgeon here at Dr. Phillips Hospital for Orlando Health. I do a lot of invasive general surgery and a lot of hernia repairs. Originally from Oklahoma, and came down after medical school at OU, where I had my residency training with Orlando Health, and after graduation, going down and starting practice down here.
Awesome. Now, Dr. Gibbs, go ahead and introduce yourself to our audience as well.
Of course, I'm Bobby Gibbons. I'm a general surgeon. We do a lot of robotic invasive general surgery and hernia surgery here at Phillips Hospital. And I practice a little more limited. I have treated some living and training throughout the South and Midwest, and also landed Orlando for my residency training and joined a year after Phillips. Been working and growing here.
Absolutely awesome. Well, we're very excited to have you both with us. Thank you so much for taking time out of your busy schedule to join us here for our Daybreak Live. Like I mentioned, we're going to be discussing all about hernias, lots of questions to get to. So we're going to go ahead and jump right into it. So the first question is, so are hernias a common problem, or do they occur rarely? And do they happen to men and women?
So hernias are very common. You alluded to in the intro, hernia repairs a year here in the United States. Somewhere between 4 and 5 million Americans diagnosed every year. There is a slight increase in the rate in men compared to women, but very much affected both genders.
Awesome. Now, the second question is, what are the actual symptoms of a hernia and how do hernias take place?
So a hernia is really a protrusion or a part of the body protruding through natural force or a hole in the strength there of the abdominal that is normally not there. And a lot of people can experience symptoms such as pain or noticing a bulge between their abdomen and their groin. Occasionally it can be accompanied with vomiting. Sometimes the pain is not necessarily sharp or dull ache. So at times I see patients who will come in complaining that after playing with children or after heavy objects, they experience groin or belly button, which is a very common location for hernias to occur.
Absolutely. Now, are there different types of hernias out there? And if so, what are the different types?
So there are several different types of hernias. Hernias in the groin, we call them inguinal hernias, are probably the most common. There's in the groin several different spaces that hernias can occur, and patients don't necessarily notice the difference, but it makes a little difference for us. As Dr. Elms mentioned, the belly button is another very combination for hernias, but really they're anywhere along the abdominal wall, either naturally strain as patients go through life, or from surgical incisions from other procedures.
Absolutely. Now, in the past, how were hernias typically repaired? I know you guys do robotic surgeries, and it's so fascinating that we're able to do these types of surgeries in today's world. So, in the past, how were they typically repaired during surgery?
Originally, hernias have been studied and attempts of repair have been performed for centuries. We originally repaired surgeons just with tissue, so we would take our own natural tissue there, really close the hole with suture, and we found that over time the hernias came back at a very high rate, and so the name in hernias, the name is trying to get right up first because they never come back smaller or less complex or bigger and better. And so we started working with mesh a few decades ago, and so many hernias now are repaired with mesh, and there's obviously a lot of negative stigma around mesh, but it's very important to note that not all mesh that you see on TV is the use of the mesh that we use in hernias or the specific type of mesh that we use in hernia repairs. And when used appropriately, it can significantly reduce the number of times hernias come back. And so that's really how things progress as far as the way we repair them. But historically, those were done through larger incisions, what we call open repairs. So it would require a larger incision, which took longer to recover from. And over time, we've been able to advance the techniques to try to address that and make recovery easier.
All right. Now, fast forwarding to the present, you guys have a great approach. When I say the robotics is so fascinating when it comes to the type of surgery that you guys can perform when it comes to the hernias. But how do you approach and repair hernias presently in today's time with the robots?
Certainly. So, there is still a role occasionally for the traditional open repair, depending on patient factors. But many hernias now, even large, complex reconstructions, can be performed in an invasive fashion. Some of those are done laparoscopically, and some are done robotically. And there's a couple of advantages both for the patient and for the surgeon. So, as you might imagine, smaller incisions lead to decreasing pain, increase in wound complications, and can speed up recovery time. From a surgeon perspective, the use of the robot platform gives us a lot more dexterity and a lot more tools, and that has allowed us to expand the number of hernias and the number of patients who are candidates for minimally invasive repair. We've moved from fixing small basic inguinal groin hernias and small basic hernias at the belly button to now we can do big, complicated abdominal wall reconstructions through 3 to 6 small incisions.
Right, absolutely. Now, speaking of recovery, when it comes to the hernia surgery, what does the recovery look like when it comes to recovering from the hernia surgery itself?
That's a great question. I think that that's probably the most important question for the patient. All the technical aspect is something that we take care of and we worry about, but really from their perspective, when they can get back to normal life, if they can get back to normal life, those are the things that matter. And the answer is yes, that the vast majority of people can absolutely get back to normal life. And with the techniques that Dr. Gibbons was describing, they can get back much quicker than we used to. When I first started, I only performed open hernias. And those open hernia repair patients, I routinely kept them out of work for 6 weeks and sometimes even longer. And of course, that can be very disruptive, especially in a time when everybody is, trying to just make a living and keep food on the table. So getting people back to their normal life is very important. And we've been able to reduce that to just a matter of days or even a couple of weeks.
Wow.
But one of the main things we've been able to do is to really get a better pain control because hernia surgery does cause pain, and we'd be lying if we didn't say that it doesn't cause discomfort during the recovery. And I think that historically we haven't done a very good job as surgeons and as the general public of understanding that pain after a surgery like this it's okay. And we do expect a certain amount, and to say that it's going to be pain-free just because it's minimally invasive is just not true. But during the time we were at now with the opioid epidemic, I think it's more important than ever that we try our best to utilize all the options we have available in our toolbox.
Absolutely.
To reduce the use of opioids, because there are a significant number of patients, millions of patients per year, that come in for routine surgeries, get exposed to opioids, and become addicted or dependent. And so the best way to treat addiction is to never become addicted. And so we've been able to, with the minimally invasive techniques and our own protocols, which we've modified off of the advanced recovery protocols, we've been able to limit the amount of narcotics people need while providing equal, if not better, pain control. We've noted that with our we call it multimodal pain control, we use different medications to treat specific types of pain. And narcotics are good. They provide a very broad blanket of pain control, but why not address each type of pain specifically and try to only use narcotics if you need it? And that allows people to feel better in their recovery, to return to work quicker, and to have much less risk associated with narcotics. And so those have been really the big advances in the recovery after the hernia surgeries that we've experienced in our practice.
Absolutely. Obviously it is an epidemic when it comes to opioid addiction. So it's very good to hear that there's methods to combat that and, eliminate that when it comes to recovery. Now, once you're in recovery, I feel like a common question that can be asked is, what's the chance of reoccurrence? Is there a way to decrease the chances that a hernia will ever happen again?
So unfortunately, hernia recurrence is part and parcel of doing hernia surgery. There's no way to eliminate it entirely, at least not that anybody has discovered yet.
Right.
There are certainly some things that we as surgeons do to limit recoveries, and as we counsel our patients on types of repair and why we make decisions on different approaches, that plays a role. There are things that patients can do as well, both before surgery and afterwards. We know that things that increase pressure in the abdomen are going to increase the risk that hernias come back. So patients who have are fighting obesity, patients who have other chronic medical problems such as chronic cough, chronic constipation, chronic difficulty urinating, improving those, weight loss before surgery, improving those other things will decrease the stress postoperatively. Patients who are smokers or are diabetic, trying to quit smoking and get blood sugars under control plays a big role in the healing process.
Right.
And then as you go through the recovery process, it's working with your surgical team and your surgeon to discuss what specific risk factors apply to you and your type of hernia and repair, and following those recommendations in the early period, because as the healing is going on in the early part of surgical recovery, that's when the repair is the most fragile. And if you do damage in the first week, you may not know it at first, but eventually that's what's going to increase your risk of this coming back.
Absolutely. Now, for those who may be experiencing hernias or they suspect they may have one after our discussion today, how can they reach out to either one of you or someone at Orlando Health to get the help that they are in need of?
So they can reach out to our office. Our office number is 407-354-1111. 888-888-1202, or they can look online at www.orlandohealth.com and search for us, Dr. Elms or Dr. Gibbons, or any of the other very qualified hernia surgeons that Orlando Health employs.
Awesome. Now, before we close out this morning, would either of you like to share something in addition to what we've already spoke about here today?
Sure. So a couple of things to note. If you are somebody who thinks you have a hernia and it's either not been evaluated or not been evaluated by a surgeon, it is worthwhile to at least have a conversation about, does this need to be fixed? The answer is not always yes, but as hernias get larger and chronic over time, their risk factors go up. I'll also point out to our viewers in Osceola, while we're based at Dr. Phillips Hospital, we are looking to reopen our satellite office in Osceola County down by the freestanding emergency department here in the next few months. It's been closed from the pandemic, but as things are improving, we're looking forward to branching back out in that area.
Good to hear. Awesome. Well, we thank you both for joining us here on our Daybreak Live over at Positively Osceola. We hope you, as busy as both of you are, you're able to join us again in the near future. Thank you again for joining us. We hope you guys enjoyed this segment of Positively Osceola's Daybreak Live. Once again, this is Morgan Cook with Positively Osceola and Orlando Health physicians Dr. Luke Elms and Dr. Bobby Gibbons. And along with the community, we're making a positive difference in and around Osceola County.